Well, the care of MPN patients, has to realize that these are chronic diseases that individuals can struggle with for years, sometimes really for the rest of their natural lives, even if their survival has not been curtailed. So the dynamics can be very different than some of the acutely malignant diseases that we usually treat, where we treat full bore, accept whatever toxicities we have to accept, and then hope for a cure. It's a different dynamic. And with this, we see medical therapies clearly have made a big impact on MPNs, but still even patients that are responding still have a lot of unmet needs, whether it's symptom, mood disorder, anxiety, stress, a whole range of areas. Our group has really helped to quantify MPN symptoms by developing tools, and that's been helpful in drug therapy, but certainly helped to highlight we need other non-pharmacologic interventions perhaps to help patients further. So our group is looking at a portfolio of different sets of activities. The one that is most developed is really trying to look at yoga as an intervention. We have a second trial that is completing accrual that looks at a home-based yoga program designed specifically for MPN patients with modifications for splenomegaly and things of that nature, for us to learn the feasibility of delivering such an intervention to patients at home. Do they follow it? Does it make sense? Is it safe? The second study has a correlative biomarker component where they could take a slip to their home laboratory to get labs drawn, sent to a central lab to measure cytokines, cortisol, other sort of objective markers of disease, as well as impact on blood counts and inflammation. Our initial readout shows very significant improvement in a whole range of different symptoms, including insomnia, fatigue, flexibility, activity, things of that nature. Further efforts will look in the future at the contribution even of individual parts. Yoga has both kind of a meditative part as well as a physical activity part. So we hope to try to really develop a portfolio of resources that can be helpful to patients with MPNs, but I suspect as well might be relevant for patients with a spectrum of chronic hematologic malignancies. In large part, we're quite a bit further behind from our colleagues in the solid tumor world that have looked at this fairly heavily in patients with breast cancer and other diseases. In heme, it still is a very limited penetration of these sort of efforts.